All right, so most likely diagnosis question looks like breast mass type. 28-year-old woman presents to her PCP with a complaint of breast pain and lumps in both breasts. Reports that the pain is most severe during the week before her menstrual period and improves after the onset of menstruation. Physical examination, multiple tender mobile masses are palpated in both breasts. They have the masses of a rubbery texture and are located primarily in the upper outer quadrants. No lymphadenopathy. Most likely diagnosis. So cyclic breast pain, right, which is, pretty classic for fibroadenoma, but it's in both breasts, and it's like there's like multiple like tender nodules here. So I'm thinking fibrocystic change. I'm pretty sure that also has cyclic pain. I'm not as certain as I am for fibroadenoma, but I still go with A.
Yeah. Okay. Let's work through this. This is a classic question that you'll see on step two. They always try to get you to pick between fibroadenoma where fibrocystic changes. Differences are okay. Let's talk about similarities. Okay, we'll start about similarities first. Similarities is that they're both benign, right? They're both cyclical, and so they're premenopausal, right? So someone that's gone through is going through puberty, her menstrual cycles, right, and they fluctuate based off hormones. So both of them fluctuate through hormones. So they'll get more tender when you're having your menstrual period, right? And then they won't be tender after. So they both have that characteristics. But the key difference is you got to know the differences, right? Knowing what's similar is not going to help you pick the difference between the two. So the difference is fibroadenoma is usually a singular mass. Okay, that's usually singular and usually on one breast. Fibrocystic change is usually bilateral with multiple cystic changes on both breasts. So those are your differences, your key differences. Okay, and then if you go down the list, like intraductal papilloma, right? I think that's the one that likes to bleed, if I'm not mistaken. I might be incorrect there. And then breast cancer, right? That's going to be different, hard, maybe some axial lymphadenopathy, right? Maybe some puckering of the skin, right? The peau d'orange sign, right, is what they always test you on. And then mastitis is just infection, right? But yeah, any questions about that?
No.